How fragile is the US healthcare system? Millions of Americans face a sharp increase in their insurance premiums. That's after Congress failed to renew subsidies provided by Obamacare. So what's the impact for those in need, and how much politics is involved? This is Inside Story. Hello again, I'm James Bays. Millions of Americans are facing a huge increase in the amount they have to pay for health insurance. A dispute about government subsidies for healthcare was one of the main issues that led to a 43-day shutdown of the US government last year, the longest in history. But even when the shutdown ended, Republicans and Democrats failed to agree on an extension of the subsidies. So as the clock struck midnight on the 1st of January, the health costs for 24 million people rose dramatically. We'll discuss the implications for the health of millions in the US with our panel of guests in a moment. But first, this report from Michael Apple.
As the curtain fell on 2025 in the United States, so too did the prospect of affordable health insurance for millions of Americans. When former US President Barack Obama took office in 2009, about 15% of Americans had no health insurance. It's something the Affordable Care Act, what became known as Obamacare, changed.
Everybody should have some basic security when it comes to their health care.
It broadened access to healthcare using tax credits. These were subsidies that then got extended during the COVID-19 pandemic. And a political gridlock on extending those federal tax credits to Americans on Obamacare is what caused the record 43-day government shutdown a few months ago.
Or block this bill and send premiums skyrocketing on January the 1st.
The government shutdown ended without extending the Obamacare tax credits. Let's look at how many people have been affected by the federal government not extending those subsidies. That figure has doubled in the past 4 years to more than 24 million Americans. Research shows healthcare premiums are expected to rise sharply by more than double on average this year. It's estimated premium increases will push 2.2 million Americans out of health insurance immediately, with an average of nearly 4 million dropping out each year until 2034. Recent polls suggest nearly a quarter of Americans believe the country's healthcare system is in a state of crisis, with cost the main culprit. Adding to this, the Trump administration's One Big Beautiful Bill Act is also set to significantly slash the budget for the Supplemental Nutrition Assistance Program, or SNAP, which helps feed more than 42 million Americans each month. It's unclear how these everyday issues will play out in a midterm election year, in which affordability is a buzzword and could prove a huge swing factor in the polls. Michael Apple, Al Jazeera for Inside Story.
Well, let's discuss all of this now with our guests today. And not surprisingly, they're all joining us from the United States. In Chicago, we have Lindsay, health economist and policy researcher at the Feinberg School of Medicine at Northwestern University. In Boston, Neel Shah, a physician and chief medical officer of the Maven clinic, as well as founder of Costs for Care nonprofit organisation. And in Washington, D.C., Rina Shah, political strategist and geopolitical analyst. Thank you very much for joining us. And I think worth saying first that the US health system works very differently from many other places in the world, very puzzling to many. I mean, I lived in the US for more than a decade and still somewhat puzzling to me. So I'm going to ask you to take this step by step. And I'm also going to call you out if you use any jargon and ask you to explain it, just so that everyone can follow this. If I can start with you, Lindsay, let's start about how the system started and evolved. Because in many countries, the healthcare system's set up by the government. That's not how it works in the US, is it? Originally, pretty much a system based on your employer and insurance that comes through your employer. I suppose the problem with that is if you don't have a job, you don't have healthcare.
You're exactly right. So the way that insurance started in the United States was actually during World War II. So we had a wage freeze and individuals weren't able to be hired with decent salaries, and employers couldn't offer salary increases to their employees. So instead, they started offering health insurance, which is a uniquely American trait that we have right now. And then several years later, Medicare and Medicaid were added for exactly the reason that you just mentioned, which is that not everyone has a job. And so Medicaid was intended to address individuals with lower income who were not working, and Medicare was intended to address individuals who were older and have retired.
And also add to that, Neel, veterans, they get health care under a separate program if you served in the US military. Fast forward to 2010, and I think people have heard of the Affordable Care Act, commonly known as Obamacare. Why, and it was seen, I think, as President Obama's signature domestic policy achievement, why was that needed, in your view, in 2010?
Well, James, we've always had a complicated patchwork of access to the American healthcare system according to different rungs of income. And as Lindsay talked about, we have a system of access for people at the lowest income rung through Medicaid and then specialized programs, as you mentioned, for veterans or for the elderly. And then we've had this historical program for employer-sponsored insurance for people at the highest income rung. But we've always had tens of millions of Americans caught in between who make too much money to qualify for Medicaid, which is our lowest income rung program, but don't benefit from employer-sponsored insurance. And these are many people who are really trying to live out the American dream. These are people who own small businesses, for example. And that's where Obamacare, or the Affordable Care Act, came from. It was a desire to bring those people into the system and provide a marketplace to purchase health insurance affordably.
So, Rena, by the point we get to Obamacare, this has become a hugely partisan and divisive subject in US politics. You are a political strategist. You work for the Republican Party. Why is it so controversial?
Well, I think it's because Republicans in Congress just handed millions of families a massive health care bill that they cannot afford. And for what? From the messaging side, look, it was very clear to me in 2008 as I was working for a Republican member of Congress as the Affordable Care Act was being patched as to what the clear messaging was, why they opposed certain things being put in the Affordable Care Act. Anymore, you don't hear that from Capitol Hill. But I'll say this problem now is not abstract. I mean, folks are already skipping doctor visits or rationing medications because the math does not work anymore. And that is exactly my point, is that Republicans, from where they sit right now, have not been able to make a clear case for why they're doing this now. And I believe the health economists would back me up in saying that this is not saving money. It is shifting costs onto families and hospitals when people end up in the emergency room uninsured. And we also have, polling that shows this too, because politics is 100% at the heart of this crisis. Congress chose to let these subsidies lapse in a partisan standoff, and now everyday Americans are paying the price. This is the toughest part that Republicans will have to overcome when they reconvene in this Congress this month. They need to tell the American public very clearly why they blocked extensions despite bipartisan pushes.
OK, let me pick up with Lindsay, because you were mentioned there, some of those points. And perhaps you can just also update us on the last bit of the timeline, because we got to Obamacare, then we had COVID-19, and Obamacare effectively was expanded and extended for those who already had it and to others as well. Explain to us what happened in 2021 under Joe Biden.
Sure. So under President Biden, we saw the subsidies expand both in terms of how much money someone could get through the premium tax credits, and then also expand in terms of how many people were eligible to receive it. And then they were set to expire a few years later. And so now we have arrived at that point, and the premium subsidies have expired just a few days ago. And so now we are looking at kind of this brave new world in terms of, are we going to be able to get something through in Congress that's going to fix this problem, or are we just going to keep kicking the can down the road?
And Neel, in terms of the amounts of money involved, we're talking about the subsidies expiring, but the figures are pretty eye-watering, aren't they? Yes, we said 24 million Americans are going to be affected by this, but apparently, without the subsidies, the monthly cost of healthcare will rise, according to one estimate, on average by 114%. Most families will pay more than double what they previously did, and in some cases, much more.
That's right. James, this is not a small policy tweak. This is a major shock to household budgets for tens of millions of Americans. I think that's really the challenge. And between on this timeline when Obamacare was implemented and now, insurance premiums have gone up considerably, and a doubling, in some cases, thousands of dollars extra per month out of household budgets. That's just your ticket to the show. That's not even the full costs of that families have to bear. In my role as chief medical officer at Maven Clinic, I'm also a physician. We provide health services to millions of Americans across the income ladder, and mostly reproductive age families. And we see already, as Rena and others have mentioned, delays in care, rationing of medications. We have declining fertility in the United States, and the number one reason is people's concerns about affordability of starting a family. So this is how impactful it is to folks.
So, Rena, one would think this is an issue that should come to a head in Washington, D.C. Problem is, it already has done, hasn't it? This was the main reason for that government shutdown, the longest in US history, 43 days. It was one of the main clashes between Republicans and Democrats, and the shutdown ended with no resolution whatsoever.
So I'll say this, and it's a tough one when you've been in the position that I've been, having seen it from 2008 to now. I can just say this didn't happen by accident. It's classic Washington politics. Just last month, the other day, December 2025, Senate Republicans blocked a straightforward 3-year extension of these enhanced Affordable Care Act subsidies, even though 4 of their own senators, Collins, Hawley, Murkowski, and Sullivan, crossed over to support it. The vote needed 60 senators, of course, to beat the filibuster, but it was the House Republican leadership that wanted to squash any of these last-ditch efforts. So they let the clock run out. And it's because Republicans prioritize ideology over affordability, doubling down on this sort of decade-long crusade against Obamacare, even as it's leaving 22 million Americans facing these premium hikes. So the number one question I get asked is, what are the core reasons? Well, one is that fiscal hawks, like Senator Rand Paul of Kentucky, argued that it did not go far enough in undoing the Affordable Care Act. He saw it as government overreach. And then number 2, they claimed that extending would balloon our national deficit. There were estimates pegging this 3-year fix at $89 billion. So while subsidizing insurance companies and even higher income Americans up to 700% of the poverty line. So there's a red herring here. The real cost comes from the fallout. And I think Republicans are going to really feel the burn. I think this was not something they should have done, as midterms are now less than a year away, because politically, this is a high stakes gamble for Republicans. Every time they try to get to it, you've got your purists and hardliners, and they view any extension as propping up a system that they vowed to dismantle since 2010.
Rena, interesting comments coming from you, given your Republican background. Are you still a member of the Republican Party, just to be clear?
I am. I think this is just a choice that certain members of the Republican leadership have chosen. I mean, they've chosen partisan purity over practical fixes. And the bet that they've taken is that voters won't blame them. But like I just said, putting on my political strategist hat, as many around Washington have been warning, this could torch Republican seats in purple areas. So I think this is bad politics because even anti-abortion lobbies have piled on. They've pressured Republican members over fears that subsidies indirectly fund certain providers. But meanwhile, there are moderates like myself, but I'm talking moderate elected officials in swing districts that have begged for a deal to shield voters from the pain. I mean, polls have shown 70% of Americans calling healthcare a crisis or a major problem. So I think even the Republican Party and Republicans around the country agree with me on this rather than the people sitting on Capitol Hill in GOP leadership making these decisions.
And Lindsay, I've seen that some of the biggest increases in terms of what people are going to have to pay, some of these eye-watering sums, are in red states like Texas, Florida, Tennessee, Georgia, states controlled by Republicans and won by Trump.
Yeah, and I think this speaks to Rena's point exactly. This is bad politics. And so the vast majority, I mean like 9 and 10 are who actually get their care through the marketplace right now are the ones that are getting these subsidies. And the vast majority of those are people who live in red states and are Republicans. And so we're going to see a lot of, we're already actually seeing the effects of people getting upset about this and the fact that their health care is going to go up when they were promised affordability from this administration. They're absolutely not seeing it right now, and they're going to continue not to see it. And I believe that that is where we might see some movement here, is if people continue to lobby and get in touch with their elected officials and try and move the needle.
Neel, I mean, the counter-argument, I guess, would be we're talking about those affected and massively affected, 24 million people out of a country of 343 million. So it's a relatively small proportion, but I guess it will have resonance with others because Americans aren't happy with their healthcare generally, are they?
No, I mean, listen, James, I'm just a doctor. I'm not qualified to talk to the politics of all this, but it's interesting to hear Rena describe this as ideological and intentional. I think the average American, the people that I care for, they just see this as government dysfunction. And I think, you know, they're frustrated with the healthcare system writ large. They're frustrated with the government writ large. And more than the political calculus, I'm really concerned about the human toll of this. These are human beings who are delaying their life plans. And I think on a very human level, nobody should have to choose between their lives and their livelihood and their life savings. And that's effectively the choice that's been put in front of them. I'm old enough to remember what it was like when people would come to the emergency room routinely without health insurance. I think the estimates, Lindsay probably can give a more accurate projection, but certainly we're going to see millions of people who are going to have complete loss of coverage. And then we're going to see millions more who are underinsured. Right, people who technically have health insurance but have tens of thousands of dollars that they're exposed to in their deductibles, which means they're not going to get the care that they need. They're going to be sicker. And the thing about health insurance is that it affects everybody. We're all connected. I think Rena also made this point, but when you have people showing up to the emergency room that don't have coverage, that impacts everybody's premiums. And it just, you know, leads to this vicious cycle of healthcare costs inexorably rising year over year.
So, Neel, I know you're a doctor, not a politician, but you must have thought about this a lot. What is the solution to the US system? From a doctor's point of view, how should it work better?
Well, I think if it was straightforward, the Affordable Care Act or Obamacare would have been a much shorter piece of legislation. I think Nancy Pelosi famously said that they needed to pass it in order to understand what was in it. That was part of the argument because it's such a complicated piece of legislation. But fundamentally, the issue is that the price of healthcare in the United States is too high. And so even if we do some kind of stopgap measure in the next couple of weeks and bring some of the subsidies back, the root causes have not been addressed, which is that health services from hospitals to drug prices go up by 20, 25% every single year. That is not how it works in other countries. We have a very fragmented way of determining prices. Prices are not predetermined, they're negotiated market by market. One of the things I do in my role is I negotiate rates with clinics across the country, and they are arbitrarily different depending on the market. So we have to have a way of using, I think, the government's purchasing power and regulatory power to address prices at the end of the day.
Lindsay, I've seen some figures. One poll, recent poll, said 23% of Americans believe the healthcare system is in a state of crisis. 47% think it has major problems. It looks like, all Americans, not just the group that we're specifically talking about, are going to have to pay a lot more for their healthcare. And people complain about the system, about bureaucracy, about delays, about people dying because of the delays of the way the system works.
Actually, it's much worse than that. So I want to tag on to what Neel was just saying, which is that, yes, everyone is affected by these. If you walk into the ED and your care is uncompensated because you don't have insurance, yes, that raises premiums for everyone. But I also think we're missing the big headline about Medicaid work requirements, which is happening right now in the United States. So we've been talking in this program so far about individuals who purchase their health care or their health insurance on the marketplace. But we actually have this big swath of individuals who are covered through Medicaid, and that is also under attack in the United States right now.
To be clear, the Medicaid people are the poorest in society, and there are new rules to qualify and verification for them. That's right, yeah?
Absolutely.
And it affects immigrants the most. Is that right?
It is going to affect immigrants. I would not necessarily say it's going to affect them most, because there are a lot of people who are not immigrants in the United States who are hardworking Americans. But to qualify for Medicaid under this new regime, you have to prove through a lot of red tape and bureaucracy that you are working X number of hours or trying to find a job for X number of hours per month, per week. And that seems great on the surface, but in reality, when you're operationalizing it, you really see a lot of people who are going to lose their insurance because of all of the red tape required to prove that they qualify for that program. So it's going to be a lot worse than what we're describing in terms of just these premium subsidies expiring. We're going to see people who have lost their insurance through the premium subsidies being rolled back, who are looking for the safety net, what we call the healthcare safety net here in the United States, and it's not going to be there to catch them anymore. And so people are going to be paying higher taxes. They're going to be paying higher premiums for all of those people's care who is not insured anymore. And then we are seeing a lot of the states who are going to be kind of picking up the tab too, because to push these Medicaid work requirements through, the Congress had to kind of couch it as this is going to be saving, millions and billions of federal dollars. Well, that need for that care and that cost doesn't go away. It just shifts it onto the states. So we're going to be strapped in more ways than one here.
Rena, let's go back to the politics. 11 months away, November the 4th, midterm elections. Explain why that is important. The party of a sitting president almost always loses ground in the midterm elections, and President Trump's approval ratings, as I've got them, I think the latest ones here, 56% disapprove, 39% approve, 4% aren't sure. If things go as they are now, he's in trouble. How much could healthcare play into this?
Look, ultimately, Republicans calculated that they could frame this as fighting waste, fraud, and abuse in Obamacare. They claimed that subsidies lined the insurers' pockets without fixing the system. But like I alluded to earlier, the math does not add up here. Without extensions, premiums spiked an average of 114% for subsidized enrollees, and that pushed millions towards dropping coverage. And will continue to, right? When they see this in black and white, some states are band-aiding it, but nationally, it is a colossal mess. And I think that will not change anytime soon. I've got a personal tie-in here as someone who is the daughter of a doctor, married to one, and a sister of two. And also my family actually currently runs rural healthcare clinics and has for the past 4 decades in underserved areas in West Virginia. So I've seen firsthand how these subsidies kept families afloat. But Republicans letting them expire because it's part of their bigger playbook, again, shifting the federal burden to cash-strapped states and then overhauling Medicaid with deep cuts, it's just, again, really bad politics, because the end game here is dumping healthcare costs onto states while slashing Medicaid. That's just a recipe for disaster in rural America, where I was born and raised and where hospitals are already hanging by a thread. So I'll just say, this isn't just policy, it's electoral suicide for Republicans in red-leaning rural districts. Look at any polling, it will show you roughly 3/4 of the public, including most Republicans, wanted Congress to extend these subsidies. But again, it was Republican leadership choosing ideology over affordability, which is continuing to be the buzzword of 2026, because this bet on state-level fixes and Medicaid reform, which is code for cuts, are creating a crisis that will drive turnout against them.
Lindsay, yes, we're talking here about health. Yeah, very, very quickly, Neel. Yeah.
Well, it's hard to use stronger language than electoral suicide, but I think the political calculus has to depend on who's most impacted. And you made a point earlier about, who's impacted by some of this churn. It is people of color. It is women and families primarily. It is people who are, the cornerstone of the American dream. They're people who don't work for large employers, but are trying to start small businesses. And I think, again, it's harder to use stronger language than electoral suicide, but I have to imagine those people are going to be quite upset and are going to show up to vote.
Lindsay, quickly, we've been talking about healthcare, and people are angry about the price of healthcare, but it feeds in, does it not, as Rena said, to the wider anger about inflation, about prices, about affordability. It echoes all of these concerns.
Absolutely. So health is wealth in the United States. And so it's not just in terms of people having to pay more for premiums or lose their care and then have to pay more for their healthcare cash because they don't have insurance. And it's not just people having to pay higher taxes to cover all of this uncompensated care that we're now seeing. It's that when we have people who do not have health insurance, they become sicker. That makes them less able to work in this economy. And so there's going to be ripple effects far beyond not just the individuals who are affected directly by these policy changes, but also into the economy and other areas of the United States ecosystem. And it's just going to be felt all around.
Thank you very much. And thank you to all of our guests today on Inside Story. Lindsay Allen, Neel Shah and Rena Shah. A complex issue, but I think we're now better informed. If you came in midway through the programme, as ever, you can find the whole show available anytime at aljazeera.com. We want to hear from you. Post on our Facebook page. That's facebook.com/AJ Inside Story. Or we're on X, where you can find us at AJ Inside Story. I'll see you back here very soon. Until then, from me, James Bays, and the team, stay safe. Bye-bye for now.